Well, welcome everyone. I'm Dr. Rosemary Kohr. I'm the director of the Canadian Healthcare Education Network, CHEN, and this is one of our podcasts that we offer, The Naked Truth of Healthcare, and we're really happy today to have an opportunity to have a conversation with Dr. Carmen Hust, who is the recently retired chair of the nursing school at Algonquin College. So, welcome, Carmen. And we're going to start this particular podcast series off with looking at nursing and how nursing really is at a critical point. We're seeing that not just because of burnout, but a number of other factors are influencing the relationship between nurses and the healthcare system itself, to the point where we are seeing, real changes in terms of how nurses are staying in the profession. So, I think that's the place where we're really seeing a trend that nurses are beginning to leave the profession um, at before they reach the age of 35. We're seeing that this is, across Canada, we're seeing a trend. 40% to 80% of nurses are leaving the profession by the time they're 35 years old. So this is a staggering number, and this is an increase over year, certainly since 2013. I think that was one of the points that we saw was 2013, when there's a 25% increase in nurses leaving the profession. So it's past time that we need to really be talking about what this is and how this is impacting nurses, how this is impacting education, healthcare organizations, and the public. So, Carmen, what are your thoughts on this?
I think it's terribly tragic. It is terribly tragic when you think about the investment that these nurses have put into their education today, and in in Canada, across the country, we could probably say tuition is about $10,000 a year per student for an RN. So $40,000, but then also that doesn't include taxpayer money. In order to educate a nurse is a phenomenal amount of money. You can double it, the count, because there's grants across the province that go into post-secondary education to help educate and develop the skills and knowledge that a nurse needs. Hospitals have costs as well when nursing students come to their facilities. They need mentors, they need preceptors. There's a cost that's entailed to that. And so, and an important cost, like nurses do it. I mean, because lots of nurses volunteer their hours to be preceptors. But the point is there is a cost, there's a cost, and there's a huge, tremendous cost when nurses leave the profession, you see. And the studies also show that, I mean, Quebec, the Montreal Institute, Economic Institute did a study in 2023. Now, these are for Quebec's numbers. They basically said for every 10 nurses, 1,000 are served, 1,000 people in the community. And so when these nurses leave, we're looking at seasoned nurses who, first, the cost, and then secondly, the cost to the community, the cost to our society, the cost to our healthcare system is phenomenal, is phenomenal. And so I really feel that we can't just say, oh, well, we're just going to put more soldiers on the front line and we're going to create new nurses. And we're just like, 'cause having been an educator for 25 years plus a chair, and saying, oh, produce more nurses, produce more nurses. But if we don't look at the issue, we can't just produce more nurses and then have, in some provinces, 80% of the nurses leave before they're 35. And we can't do the same. Like in other provinces, it's 40% your stat at the beginning, but it depends on the province, what's going on. But 40% is atrocious. 80% is unfathomable. You cannot run a healthcare system. You can't run a business when 80% of your experts or you're proficient. We won't even call them expert because, we're talking about 7 years into a profession and they leave. I mean, this is terrible. We can't
Right. When
run
the,
the
and
system.
I think too, in terms of the organizations, the healthcare organizations, the orientation time frame, the ability for the new nurses to be able to kind of acclimatize to the role is also
Yes.
really challenging. So, there's so many, I think, trying to identify the specific kinds of issues. I think that's one of the big things that we need to look at is, we have nurses and media talking about burnout. We
Mhm.
have organizations talking about just the challenges to be able to upskill, or if someone is going into work, a new grad who's going in as a who's going into an ICU, for example, or emerge, or any of the really almost any area in nursing. When you think about where are people working, when you consider that the expectation then is on really relatively new grads to be able to take charge positions, for example, and when you start to think about those kinds of challenges that individuals are dealing with, it's putting somebody in a saying, well, you're going to be the captain when you've only had 20 minutes to read the manual.
That it's a terrible, it's a tragedy. It truly is. For instance, we say that, a new nurse, when she graduates, she's got knowledge and skills as an entry practice, which is wonderful, and celebrate that. That's wonderful. But it takes still about 3 years in practice to feel that you have some measure of confidence in that area. So those first 3, 4 years are extremely important in terms of developing confidence. You have competence, but confidence that you're doing what you're doing. So we don't, and you're doing it well, and you're doing it to the best, and you're not missing something, and
Yeah.
that gut feeling, you're confident in that. So we really need that, and those nurses need that.
Yeah, and being
So,
able to, oh, I was just going to say, and being able to have mentors
yes,
in
you
your
need,
practice who can be, mentors that are the unofficial, the people you work with,
yeah,
the team
yeah,
members that you have, to be able to feel that if you have a question, you have somebody that you can go to and say, does this, I'm sort of wondering, is this okay? Like, you know,
right.
to
You
have
need
somebody to talk to. Yeah.
You need that. And those, so what's happened in our healthcare system is that we have really complex healthcare. We saw this already when I was a prof, and we wanted to get mentors, or we wanted to get preceptors in the healthcare field for our new nurses, our student nurses. You need to have somebody who's seasoned to do that. You need somebody who, has at least 5 to 10 years experience, which is exactly this 35-year-old nurse. Think about it. You graduate when you're 25, 35, you're leaving. So this is exactly the person that we desperately need to help bring confidence to the new nurses. So
Mhm.
this is an extremely significant cohort that's trembling. This is
Yeah,
it
yeah,
significant.
yeah. And that's a good way to
Yeah,
describe it, I
yeah,
think, because
yeah.
we're really, and you kind of hit on a point too when you mentioned the complexity
Yeah.
of the environment that
Yeah.
people are going into
Yeah.
as new nurses.
Today, when you walk into a nursing school and you want to go on a clinical or something like this, the chances of you meeting a entry care kind of healthcare person who just needs vital signs, which is the skills that you're learning, and a health assessment, are zero. You will not meet that in the healthcare system today. Maybe you did 30 years ago, but you don't today,
Right.
because people are very complex. They have complex healthcare issues. in the bed in the hospital. They just do. So you need somebody who's seasoned to walk alongside that new nurse to develop them, to develop their confidence. They also graduate. They also need the seasoned 35-year-old nurse. We'll just say, actually, it's the 10-year experience nurse is what we're really talking about. That who can really just can kind of cut through it and say, this is the priority. All these things are important, but this is the priority. And that's where the confidence comes. So we need these people, and we can't let them, walk away from the profession. They're super.
So then the question is, I mean, I think on the one hand, we could spend an hour talking about the challenges, the problems, the issues, and,
Mhm.
certainly highlighting them like this is really, we have to say this
Yeah.
because people are not paying attention to
Mhm.
the fact that this is a crisis.
It truly is.
We are,
Yeah.
and, it's hard because we've got so many other crises going on around us. But if
Mhm.
we don't pay attention to this is going to be really problematic
Mhm.
going forward, particularly with the demographics. I mean, you just have to look at statistically what's
Mhm.
going on.
Yeah.
But,
I just want to pull back a second to this important cohort of nurses. Um, when a nursing school is looking for clinical placements or preceptors when a student is at the end of their baccalaureate training, we are looking specifically for these kinds of nurses to take a new nurse under their wings.
Mhm,
Um, we have had to decline placements. There have been situations in nursing schools where there are no placements
mhm,
for students, especially if we're looking at summer months or we're looking at places. There are no nurses to take them on because this this 10-year in cohort isn't available, or isn't there. And so the impact is, you can see the bottleneck. The government says take another 100 nurses in. And we kind of say, well, where are we going to put them? Who are the clinical people who are going to be able to help us to take them on? We're not creating space in our system. We're not rewarding this 10-year in nurse practitioner, this nurse specialist, this nurse who has this thing. So we're not rewarding them. We're not celebrating their expertise. We're making them feel disvalued. We're making them feel, and the reason we're doing that is by the scheduling, the way we do things. We don't permit them the space to be able to help other nurses coming in.
mhm.
They're frustrated. It's not that they don't want to, it's just where in the system is there a space for nurturing? Where, you know?
So this,
And
so this is a critical factor, right? Like, I think this is where when we talk about, what needs to change, what are the kinds of things that organizations, so government, academic institutions, the employers, where they really need to be sitting together to say, what are we going to do to fix the problem?
Mhm.
So, I think that's kind of where, and this is a conversation that you and I are having, but we really want to encourage people to think about this and participate in our conversation because it's crucial. It's crucial. So, where would you, if you were going to, well, I mean, we are looking at this. So when you want to consider, or we want to consider what kinds of changes we need to really be looking at, what are the things that come to mind for you from your experience?
Well, I I believe it's really, really important. I mean, I could speak from my experience, but I want to preface that I believe that we need to get the nurses that represent this cohort. We need to give them voice. They need to be able to speak completely about the issue. We need to get the unions around the table too. We need to talk about these issues. We need to get our management around the table. I believe hospitals want the best care. I believe administrators want the best care. But I believe that the expectations, we are human. We need space to live. A nurse can only offer that which she has. And so if she is struggling with moral distress about her work, if she is struggling or he is struggling, or they are struggling, because of demands, life balance demands and stuff, they need a space. They need to talk about this. And as employers, I believe we can hear that and realize that this is the backbone of our healthcare system. These are highly trained individuals who can offer immense service to our, like, 10, for every 10 nurses, 1,000 people are served. If we look at this report, this isn't no one, this is really important. And if we give them the opportunity to work full scope, that they feel supported, they have flexible scheduling. I mean, COVID threw an incredible wrench into a lot for us. So, nurses were required to work, they have to work overtime. It's in their schedule. They have no choice. They have to shift work, whatever, all the different things. Of course, we work 24/7. Nobody's questioning that. But allow the nurse voice in the scheduling. Don't panic, hospitals, that, oh no, we're not going to cover shifts. I assure you that these nurses know what's needed, but they need a space and a voice to be able to participate in solving the complexities of the
Yeah,
healthcare.
and that I think you hit a really important point here because, in my experience too, working as a clinician for 25, 30 years, in institutions, various types of institutions, whether it was, community or acute care or the long-term care sector, but really watching how the actual on the ground practitioners were not the ones who were engaged in those administrative discussions around, how are we going to actually make this work? And, everybody has their own agenda. I mean, it's, unions have an agenda, the institution has an agenda, the government has an agenda. So really what we need to be thinking about is how do we make this work effectively with the voices of the actual people who are doing the work, who
Yeah.
can say, listen, here's how we can set this up in a way that's going to be reasonable for us so that, again, eye on the prize, which is keeping people in the profession in a way that they're going to be happy and, comfortable to be able to do this as well.
Mhm.
Yeah,
I think I forgot one major player too. The educators too need to be on that
for
table too,
sure. Yeah,
because I do believe, if we're educating but for an unrealistic expectation, I think we have to realize that too.
oh,
The
big
truth
time.
is, we used to say, I sometimes get embarrassed when I say that in my time, but anyway, that, when you graduated, you worked in med surg for a couple of years after you graduated so that you consolidated your knowledge or
Right,
whatever.
right.
Well, that hasn't happened in a long time. People
Yeah,
are going directly into specialties. And so as the educators too, have to be in this. What is happening in the workforce so that we really help launch nurses into the profession in a way that they can run with the pack. But I'm expecting the pack to take care of the nurses too. Like, it's both sides, we can't just, I get very concerned when, the government's just telling us to produce more nurses. And I go, well, in New Brunswick, to have another 80% or 80 people of the 100 in my cohort leave in the next 7 to 10 years, as
in
an
the next
educator, that
year
breaks
in New
my heart.
Brunswick.
Yeah.
Yeah, New
In the
Brunswick is
next,
in the next year, which is
so just
terrifying.
it's
Yeah,
terrifying, so I mean, as an educator, that's demoralizing, that's horrible, so we can't just prepare people for something that's not realistic.
yeah,
We also can't launch people into, a game, let's use that a metaphor, that they're not prepared to play in. And so they just get tackled and that's it, like this isn't working. And we need to have, you know, the people, the referees, the business people, whatever it is, that metaphor, they have to understand that, these nurses need to be uh, understood. Their roles need to be understood. They need to be working to full capacity. They are people and humans have lives. And also, when we're talking about somebody 25 to 35, we're talking about people who are also looking at developing their whole being. So that could be family, that could be lots of things in their life, maybe not. But there's other things in their lives that need equal space. So as that flexible, I'll just go back to that flexible scheduling. And so is vital. It isn't optional. It isn't a nice thing to do. I think another thing too is that we know that nurses work all kinds of shift, all kinds of hours. We also need to look at benefits that are proportional. We just, enough of this, only the full-time people get stuff, because it's not realistic. They need to also understand, we also need to understand that healthcare or is constantly evolving and constantly changing. You train or you teach someone, you educate someone for 2025, but by 2026, there's been a change and a development in how the care is provided or whatever. Continuing education isn't a nice little sideline for aren't we lucky where we work, they have at continuing education. It should be always. Every nurse should always have continuing education as part of that workplace dynamic because it's not realistic to say, I can still practice with 10 years old.
Oh, and we
Not,
really, and that's
no,
been my sort of thing for many
yeah,
years with wound care,
yeah,
because that was certainly, is that my
yeah.
specialty, one of my specialty areas, that certainly was something that I have seen repeated over and over again, which is, people are learning from clinicians who were trained, 15, 20 years ago. And I'm sorry, the practice has changed.
Right.
Wounds, the body hasn't changed, but
Mhm.
the ability that we have to assess, to treat, to manage, that's all changed. Plus the comorbidities that people are experiencing now. And
Mhm.
so that to me is kind of a microcosm of what we see in probably every component of healthcare, which is, you've got a practice, a way
Mhm.
of, responding to something that has gone through a big transition, but that hasn't somehow made it to the bedside. And the reason that has happened, like you say, is that continuing education is not, it's considered a frill.
Mhm.
It's not considered something that is part of what it is that we do. And I have to say, in medicine, the continuing education is part and parcel of what they do. They are provided, physicians are provided with funding to be able to access continuing education. They get credit for this. We don't do this in nursing. There is no kind of expectation of a certain number of, continuing education credits. So there isn't any emphasis placed on maintaining your current practice, really, other than saying, well, you should do this, in
Right.
your spare time and
Right.
pay for it
And
on your.
that's part because I believe that this nurse, again, this, 10-year practicing nurse, they want continuing education. They want to feel, that their knowledge is valued and that they are contributing. They want that.
Well,
They
and
want flexible scheduling. That's what they want.
it's one of the
Um,
things. I'm just going to say, when I did my PhD,
yeah.
that was what I was looking at, was what is the nurse's experience? And the nurses, every one of them that I talked to, from whatever background they were from in terms of where they were working, every one of them said, I don't feel that I know what I need to know.
Mhm.
I don't have the time to learn what I need to know. And I love what I do.
Yes.
So how do you bring all of those components together? So
Mhm.
I think we're at a point where we can finish the conversation now with our beginning of unpacking what this looks like. And Carmen, you and I will have more conversations. And what I want to encourage people to do is comment.
Mhm.
The other thing as well, subscribe to our podcasts and really let us know what you think about this. It's a really important foundation of what it is that we have to really look at as the healthcare field is evolving. So, Carmen, I'll leave you to last words from you.
Oh, well, thank you very much for this chat. I do hope the whole purpose of this is to open up a conversation so that we all start speaking about it. I really want the nurses' voices to be heard. I hope that we hear from, or that, these nurses, these very important nurses in this cohort, are speaking up. These nurses with, 5 to 10 years experience, that we need you to stay, but we need to know what it is that we need to do to make you feel that your work is as important as it is, because I don't think we've done a good job making you feel as valued as you need to be. Happy Nurses Week.
Yeah, we're going to keep the conversation
Yeah,
going. It's great. So
yeah.
don't forget, like, share, subscribe, and we'll see you next time on our podcast channel, The Naked Truth of Healthcare.